I can start.
Yes, sir.
Good afternoon. I think this particular month is called as Scleroderma Awareness Month. Though it's relatively a rare disease, not really to be considered as a rare disease comparing to few other diseases, but it's one of the little less known and little less common autoimmune rheumatic disease. What is this scleroderma? Who gets affected by this scleroderma? How can we pick up this scleroderma very early in the course? What is the advantage of picking up the scleroderma early in the course? What if we don't, and what if I figure it out early? How things can change if we pick this disease early is something what I'm going to discuss in next 10 to 15 minutes. And that is the whole purpose of this awareness month. The word scleroderma is derived from the Latin terminology. Sclero means becoming thick. Derma is skin. Skin getting thickened is what we call as scleroderma. So it's a sort of autoimmune disease, and it has a huge spectra of its clinical manifestations. It could be very subtle. You may have small patches of skin becoming thicker, and that's what it is. That's what we call as localized scleroderma or morphia. And sometimes it could be only present in the limited amount on the hands, and very limited involvement of the internal organs like lung, and sometimes the lung pressures, and little bit on the esophagus, and goes slowly over a long period of time, stretching from few years to several years. And there is something what is called as aggressive or a progressive systemic sclerosis. In progressive systemic sclerosis, the disease starts and gradually over a period of months and sometime in years spreads to thicken the entire skin. In addition, can also produce problem in the lung, what we call as interstitial lung disease. It can also produce the problem in the entire gastrointestinal system, what is called as sclerodermal gastropathy, or it can produce a dilated esophagus, which we call as dilated esophagus, and so on and so forth. So you can have several different processes and mechanisms or presentations it can have when it comes to different clinical manifestations. So that being the case, how can we figure it out? How can we identify? And what is the consequence of having scleroderma not diagnosed? As I said, if it is a small patches of skin, other than little cosmetic things, it may not have much implication. So usually some simple medications can take care. But whenever we see these conditions, our concern is to find out whether it is more systemic or just regionalized to the skin. So the usual manifestation initially could be very subtle. Patient may feel little discomfort in the hands, and some may have a severe, moderate, mild, or severe type of joint pain, especially in the small joints of the hand. You may start seeing that skin becoming thicker, especially on the back surface of the hands as well as the back surface of the fingers. And normally, if you remember, as we grow with the age, with the time, you have a lots of folds on the skin, on the between the joints in these areas. So these starts getting ironed out as if they smoothen out, and they become little swollen, edematous, and you find difficulty to move the fingers. And same changes can happen on the back of the hands, over the arm, all over the face. And those folds which you see on the phases of the skin may slowly disappear. Skin may become more shiny even if you don't apply the oil. People may ask, have you applied the oils? And the skin, instead of being lax, may become little stiffer, and slowly it becomes thinner. It becomes stiff and thin over a progressive period of time. So along with this skin becoming thicker, the lungs, which is a smooth, deflatable balloon-like things, may become stiff. They become what we call as interstitial lung disease. So patient may start developing cough initially, may feel breathless when he exerts even a little bit, may gradually over a period of time, may become more and more breathless even with a little movements. And also in some individuals, along with the thickening of the skin, even the blood circulation in the lungs may become thick. So especially the blood vessels. When the blood vessel become thick, the resistance for the circulation increases. That produces what we call as pulmonary pressure. There is increased pressure in the circulation in the lungs, what we call as pulmonary hypertension. That in turn increases the difficulty for the right heart to pump the blood into the lungs. So right heart may start giving away. Similar thickness can be seen very unusually in the heart and also in the muscles. And sometimes the muscle may go on wasting, the muscle become weak. Usually these patients don't increase their weight, gain the weight, because some fat beneath the skin becomes too thin and may not be able to lay down those fats. And face starts shrinking, and you may see the prominence of the malar, prominence of the buccal fat shrinks. So as a result, there could be a little bit of disfiguring on the face. So overall, this is a sort of both a disfiguring of the individuals as well as start affecting the internal parts like lungs, unusually the kidneys, and so on. One of the major problems we see sometime in them is called a scleroderma crisis, especially when people use steroids in the beginning and suddenly stop it. The kidneys, blood circulations may become thicker. As a result, the blood pressure may shoot, function of the kidney may become altered, so creatinine may increase, urine output may drop, and patient may go into a sort of high blood pressure crisis. In that high blood pressure crisis, patient may land up in left heart failure, and we may sometimes lose these patients. But of late, with the advent of use of good drugs, and also being known now that if we don't use steroids, these kind of problems are less. And advent of a drug called ACE inhibitor, angiotensin converting enzyme inhibitor, which we commonly use as enalapril, ramipril, and those group of compounds, when we use them in these patients, have really made them survive through. So overall, the scleroderma is a slow progressing disease. Everything becomes thick. The skin becomes thick, the mucosa becomes thick, lung becomes thick, circulating vessels become thick. Wherever we say what we call as collagen, the extra collagen, which is stiffer, lays down because of autoimmune process, and that results in varieties of clinical features and problems. Gradually, as you know, if lung becomes thick, breathing becomes difficult, vessels become thick, circulations get impaired, and also as a consequence of involvement of the circulation, you may feel something what is called as Raynaud's phenomena, which is one of the very earliest signs you see in these patients. But we may not see it in the tropical countries, but we do see in the places where the temperature drops below 10 or 12, where the tip of the fingers turns pale white, followed by bluish discoloration. So that is the type and shape how things can work in this set of patients. So gradually things develops Raynaud's, and from Raynaud's, the patients may go and develop varieties of other clinical manifestations and then work towards in developing lots of other problems and complications. The disease, if identified early, you can prevent the progression of the disease. Now, how do we figure it out? When patient comes with little change and alteration of the skin, please check with your dermatologist, check with your physician, check with rheumatologist. Is it something like a scleroderma? If face skin becomes bright and oily, and you feel that the skin has become stiff and stuff, that's one of the places where one can think of possibility of scleroderma. I said the Raynaud's phenomena, when you touch cold things, if your fingertips becomes bluish and discolored, what we call as Raynaud's, think of possibility of scleroderma related diseases. If your mouth opening becomes little difficult or stiffer, other than because of the dental problem, think of possibility of scleroderma. When the folds, which is supposed to be otherwise there, if they are not happening, possibility of think of scleroderma. And when the lung becomes thicker or you feel breathless, etc., X-ray and CT scan shows interstitial lung disease, there is a possibility of scleroderma. So these are all the places where we can identify whether an individual is suffering from scleroderma. This can be confirmed by skin biopsy sometime. If there is a lung involvement, we can do CT scan. And there are some blood tests, what we call as a ANA, which will be usually positive in 70 to 80% of the patients. And if you do our subtype of autoantibodies, we have SCL70 and we have different other autoantibodies, which can be represent a possible scleroderma conditions. And when these tests are positive, also we can suspect a possibility of scleroderma. Availability of these tests have helped us to pick up the disease very early in the course, because if you have a skin change and if you have these autoantibodies, even without full-fledged disease manifestations, we are able to now pick the disease scleroderma in the early course. The biggest advantage of identifying the disease in the early course is you can stop the damages happening. As I said, skin becoming thick, lung becoming thick, or the circulating system become thick is a time-bound process. Since it's a time-bound process, what we can always do is, if I stop the fire in the very beginning, you can prevent the damages happening to the organs. So we use a lot of immune modulators, immune things, which can help in preventing the further deterioration of the skin, or further deterioration of the lung, or further deterioration of the blood vessels, etc. 2 decades back, we were not aware that we were not having conclusive evidence that these drugs can help. But current research, current studies have made things clear. If you figure out early, identify and treat them early, we can prevent a lot of damages happening. Even otherwise, at least we can slow down the process happening, and the people and the patients can live a normal life. So that being the case, so one of the key for making the life better for an individuals who are likely to have or who are unfortunately likely to develop scleroderma is to identify them very early in the course of the disease. To make it identifiable early in the course of the disease, patients and the society should be aware there is an entity called scleroderma. Scleroderma can be figured out by the skin changes that what I was discussing about. When they are present, see a dermatologist or a rheumatologist. They should be able to identify, do the tests which are required. And based on these tests, we can figure out or identify what is the likely possible disease or scleroderma. And now we have a lot of medicines which are available. We have a drug called rituximab, we have a drug called azathioprine, drug called mycophenolate mofetil. Even a simple drug, what we use in rheumatoid like methotrexate, can reduce some of the adverse problems that are likely to happen. And a combination of these drugs with few of the biologics like anti-IL-6, these drugs are going or helped and change the way the scleroderma can be treated. And also the drugs which are like antifibrotic drugs which are available like ninitinib and other many of those group of drugs have made life very different for them, because these drugs prevent the progression of the disease and also improves the functionality of the skin, lung, and the blood circulations. In addition to that, of course, a symptomatic help can always be of benefit using nebulization, using anti-gastroparetic drug, and using the lot of other symptom-related drugs can help in making their life better. So overall, currently as we stand, there is a good progress in management of scleroderma, but only catch is if I figure it out very early in the course of the disease. So if we identify the patient in the very early course of the disease before the damage ensues or results, you can really do a wonderful things. What I always say is, if you can identify the fire much before it damages a lot of things, you will salvage or save the entire house. Maybe you may lose a small door or a small furniture, but you can literally save the entire house. So it's best to know that we have an entity called Scleroderma. It's an autoimmune disease, and there are way out for treating these diseases. And best is you to approach a dermatologist or a rheumatologist or a good physician who knows about these diseases in managing this in long term. Thank you very much for patience hearing. Please spread the information about these, and they can log in and try to learn about these diseases so that we can identify these diseases and help these patients to do much better. Thank you very much for patience hearing. Please join in this momentum of making people aware about the scleroderma. Thank you.